There are now 6 FDA-approved neurotoxins on the market. Letybo just launched in the US with some pretty interesting clinical data that every injector should know about. So, in this video, I'm breaking down exactly what Letybo is, how it compares to Botox and Daxxify, and whether it actually makes sense to add it to your practice. Let's get into it. Letybo, the brand name for letibotulinumtoxinA, isn't actually new to the world. It's been South Korea's #1 neurotoxin for years, sold under names like Botox, and used in over 65 countries. It received FDA approval in February 2024 for moderate to severe glabellar lines, the 11s. Let's compare the 3 names you're probably thinking about most: Letybo, Botox, and Daxxify. Onset. Letybo often kicks in within 2 to 3 days. Sometimes patients notice changes as early as day 1. Botox and Daxxify both typically take 3 to 7 days. Duration? Letybo and Botox are similar, about 3 to 4 months. Daxxify is the outlier here at 6 to 9 months. Cost to the patient. This is where Letybo gets interesting. Many U.S. practices are pricing it roughly 10 to 20% below Botox per unit, so around $9 to $13 per unit versus $10 to $18 for Botox. Daxxify runs higher per treatment, though patients come in less often. Diffusion? All 3 are moderate to low moderate. One thing providers report is that Letybo behaves predictably. It has a controlled spread, which is useful for precision work like the glabellar complex. In Letybo's pivotal BLESS Phase 3 trials, which included over 1,200 subjects, 0 neutralizing antibodies were detected even after repeated treatments. For context, neutralizing antibodies are what can cause a patient to stop responding to a neurotoxin over time. Who is Letybo for? Patients who want natural-looking results. Providers describe the finish as soft, not frozen. Cost-conscious patients. The slightly lower price point makes it more accessible without compromising quality. Patients who want faster results. If someone has a wedding or event coming up, that 2 to 3 day onset matters. First-time neurotoxin patients. Several practices report that toxin-curious patients find Letybo less intimidating as an entry point. A few things to keep in mind before you start injecting. 1. Units are not interchangeable with Botox. Even though dosing looks similar on paper, you'll want to follow the manufacturer's guidelines and expect to fine-tune your technique. 2. The FDA approval is for glabellar lines, but providers are using it off-label for foreheads and crow's feet with typical starting doses, similar to what you'd expect from other toxins. 3. When you introduce it to patients, don't frame it as a Botox replacement. Position it as an option, another tool in your toolkit that lets you customize treatment to each patient's goals and budget. So is Letybo right for your practice? That really depends on your patient demographics, your positioning, and how much you want to invest in training and patient education. But if you're seeing cost-conscious patients, first-time injectors, or people who prioritize faster results and a natural finish, it absolutely deserves a serious place in your practice. If you want to go deeper on Letybo and how to incorporate it into your practice, IAPAM has the training and resources to get you there. Check out the link in the description to learn more.